Do you hate the expensive costs of healthcare? Then stop paying the outrageous fees that are associated with receiving medical care. A growing issue is that 1 in 5 U.S. citizens cannot afford healthcare. In fact, approximately 10% of an individual's annual income is spent on healthcare, or around $4,968. According to recent economic trends in medicine, these numbers are projected to significantly increase as a direct result of stark capitalistic tendencies exhibited by the U.S. healthcare system. Consequently, 50% of ill individuals either do not possess or cannot afford healthcare, and thus are unable to receive the assistance they need. Universal healthcare seeks to provide treatment to every U.S. citizen despite their race, sexual orientation, ethnicity, religious beliefs, or background. Another pressing issue is the exploitation of the disabled, minorities, and lower socioeconomic classes by the U.S. healthcare system. Citizens are unable to access quality care at an affordable cost, which exacerbates the discriminatory acts executed by healthcare professionals. The World Health Organization estimates that approximately 100 million people are in extreme poverty, living on less than $2 a day, due to having to pay for healthcare. In other developed countries such as France, Canada, Great Britain, and Scotland, cost control measures are established by providing federally funded aid aimed at lowering the overall cost of medical services, which in turn reduces the financial burden that affects low-income individuals. Their healthcare systems don't require the high administrative costs that drive up pricing, as demonstrated in the United States. These governments can negotiate lower drug prices, more affordable medical equipment, and lower hospitalization costs. Increased federal involvement in the medical sphere can influence a variety of treatments used and a patient's overall accessibility to specialists, which enables these stakeholders to seek more expensive treatments. However, our current system lacks the economic funds necessary to implement and sustain a universal system within the United States. The mission of the Universal Healthcare for All movement is to advocate for the extension of medical treatment to all U.S. citizens, regardless of insurance, socioeconomic status, race, ethnicity, religious beliefs, or background. By altering our current medical infrastructure, we can decrease the mortality of illnesses and increase the longevity of American citizens. Why should you care? Every individual should have access to healthcare whether or not they can pay. Healthcare and the right to good health is a fundamental human right. Medical care should aim to provide the highest treatment to its stakeholders. What can you do to help? To spread awareness, you can use social media platforms. And to receive frequent updates, follow our social media and tag us and use our hashtag #WeStandWithUHFA. Get creative and start your own trending hashtag, challenge, or post to rally support for our cause. You can also organize rallies, protests, or campaigns to advocate for universal health care in the U.S. Encourage the government to take action and appeal to political figures. You can also place posters, flyers, and yard signs in public spaces. By joining UHFA, you can help us promote a universal healthcare system that can reduce the overall cost of care and the number of individuals who are forced to live without the care they need. Healthcare is a basic human right that is necessary to sustain a long, healthy life, and it can only be done with universal healthcare. UHFA, Universal Healthcare for All. United today for a better tomorrow.